All right, get started for the EMCC meeting for September 10th, 2025. And we could start with introductions. Introductions in the room.
All the members. Will Hiller,
Here.
David Sargenti,
Here.
Jody Schaefer, Paul Wood,
Here.
Marie Lutz,
Here.
Carlos Spencer, Chris Morgan, John Anthony, alternates, Cheryl Guess, Joe Faro,
Here.
Paul Tomasi, who is retired, and we'll take him off. We have a quorum. So, others who would like to introduce themselves, actually, let's go with, the ex officio members, Teresa Rios,
Here.
Leanne Migoski, Chelsea Scanlon, and then, we'll
Steve. Chase Sullivan, side fire.
Ben Hitchcock, AMR CES.
Rachel Nealon, AMR.
3, start.
Okay, thank you very much. EMS agency staff, we'll start here. Really?
John Burley, EMS Agency.
Kimberly Hernandez, EMS Agency.
Karina Moreno, EMS Agency.
Devin Delaney, EMS Agency.
And Steve Brooks, EMS agency. For attendance.
Do we want to go through online participants?
Oh, yes, I'm sorry. Online participants.
Dr. Bright, San Valley State Prison.
Hi, this is Betty Hull. I'm the chief nurse here at CTF. Thank you.
Emmanuel Vega, Greenfield Fire.
A phone number with no name if you would like to introduce yourself.
I'm sorry, that's probably me, Dr. Bright, San Valley State Prison.
Oh, Dr. Bright. Okay, thank you. Sorry, I was writing instead of looking up. All right, thank you very much. I don't think we missed anybody.
All right. So moving on to public comment, any member of the public may address the committee for a period not to exceed 3 minutes on any issue not on the committee's agenda. The EMCC will listen to all communications but may not take action. So any public comments for today? Okay. Moving on to approval of the past EMCC meeting minutes. So that would be from July 9th, 2025. And Steve, do we take a
We can, yeah, we'll need a.
Move to
motion.
approve, Sargenti.
motion? Do you have a second?
A second.
Second from Paul Wood.
You can do a roll call or you can do just a voice vote.
We just, we could do a voice vote. All in favor?
Aye.
Any opposed? All right.
Carries, thank you.
Moving on to standing reports, EMS Director Teresa Rios.
Thank you, Will. First, I want to start by just providing a formal notification to this committee that Harry Robbins has resigned from the committee. July was his last meeting. He let us know then. We attempted to do some form of recognition for Harry and he declined. He said that if we mention anything about him retiring from the committee, that he would not be pleased. So we respected his wishes. We are actively recruiting for members, citizen representatives for EMCC. Our goal is to cover the different areas of the county. Our goal has been to find somebody from South County, North County, Peninsula, looking at different groups that we might be able to target that would give us good representation of our, population in the county. One of the ideas also, we had some senior facilities, SNFs, reaching out to behavioral health to see if we can find somebody with that background. That conversation also led to whether, and we'll bring this to consideration for the committee in the future, whether it would be a good idea to have as ex officio member somebody from behavioral health. It seems like there's a lot that is happening around behavioral health, and there's have been different issues that have popped up that I think we would be good to have somebody from behavioral health as a rep on the committee. And same with the prisons, to have somebody officially on the committee. We're still working on the ideas, and then we will bring some for consideration of the committee. I reported at the last at CCC that we lost 2 staff members. One promoted, our accountant promoted to a higher level position, and then Blake Anderson left. He got a position, I think, with San Francisco EMS. With that, it leaves us at about 50% of our staffing. I'm saying this just so that to let you know that there may be some delays when you are reaching out to us, and we're trying to minimize those. We have distributed Blake's and Carolina's duties across the team. I've picked up some of the responsibilities, and I'm working my way to get myself up to speed on, and I'm not quite there with some of the projects. But I've made very good progress on others. Also picked up some of the budget responsibilities, assisting Corina. We had to close out the fiscal year, start the new fiscal year, and that comes with a lot of deadlines for different items. So just bear with us while we do that. We are actively working with HR. We are releasing the recruitment for the 2 EMS analyst positions that are open. This time is also giving us the opportunity to assess the needs of the agency and how to best meet them. The health program coordinator position has been difficult to recruit for. We're working with HR to see if there's a different classification that would better meet the needs of the agency and the system. And there is a window for us to be able to reclassify the position, I think in December. So we're trying to catch that window so that we can recruit for that position as well. Let's see, and I would be happy to answer any questions you may have.
All right. Thank you very much, Teresa. Dr. Burley?
Thanks, Will. So in terms of EMS Medical Director report, just a few notes from our recent CCC meeting, which was earlier this morning. We heard from Kimberly regarding ambulance patient offload times. We had received a report from Steve regarding the 2026 policy and protocol review cycle, and had also gotten a report from Deborah regarding CQI tag updates and various metrics that we've been looking at over the past several months, in this case regarding pediatrics. Other things that we discussed at the meeting included an update regarding the AB 40 implementation by the EMSA. As you know, there's a state audit tool that attempts to capture patient offload times, and with the idea of trying to improve them across the state. And the different LEMSAs and hospitals have reporting responsibilities that, and so we've been working through the nuts and bolts of that. We also had on the agenda a presentation from Seneca Pediatric Behavioral Health, who unfortunately had to reschedule at the last minute, but they're going to provide a presentation to us at our next CCC meeting. Deborah was kind enough to sort of give us some brief details of the program. They're basically a pediatric crisis stabilization unit, and they also have some pediatric beds as well for inpatient. We believe it's about 6 beds, and they currently, take patients on Medicaid and uninsured for the most part. They've been open for a couple weeks now, about 6 weeks, and so we look forward to hearing more from them as they continue to, go through their service and work with our various stakeholders. So those were some of the things that we discussed at CCC. Happy to take any questions on any of those items.
Thank you, Dr. Burley. Moving on to item C, MOAC, Deborah.
Morning, I'm going to provide the update. Deborah was unable to be at this meeting because she's at another meeting. So MOAC activities since our last report in July, we provided Car Week support, developed and implemented a medical plan to support event operations, participated in kickoff and coordination meetings with partner agencies, and there were no significant medical or health-related incidents reported. We participated in Healthcare Coalition meeting, which they had presentations on extended downtime protocols for healthcare systems and an overview of the national disaster medical system and regional integration opportunities. We participated in the Golden Eagle 2026 exercise planning. We attended the initial kickoff meeting and are waiting further guidance from DEM regarding county participation and the medical health roles. Future activities before we report next, we're going to be working or participating in the 2026 medical response and surge exercise planning. The planning meetings begin in September, and there is a full-scale exercise scheduled for late March to early April 2026. Happy to answer any questions that I can. If I can't, I will definitely forward those to Deborah. Anyone have any questions? Okay. I'm going to stay up here because there's a few items that are mine.
So
Okay.
Kim will be doing the communications testing report as well.
Okay, so communication systems testing, you have in your agenda packet, the 800 megahertz radio compliance report and also ReadyNet. The hospitals have been great about responding and providing feedback on the results to identify areas for improvement or even share changes within the hospital that to increase compliance. In addition to that, hold on, let me get my notes out. At our last meeting, there was a request that any issues identified during communication system testing be reported in a more timely manner, since waiting till the end of the testing period could not allow for quicker resolution, and reporting it sooner to the hospital would minimize downstream impacts. So there is a policy update in progress in response to this concern. The EMS agency has revised policy 3000, which addresses system testing protocols and communication standards. The updated policy is currently open for public comment. So the public comment deadline is September 26th. So we encourage any stakeholders to review and provide feedback on policy 3000 to ensure their input is considered for the final version. In addition, the policy and protocols will be brought to future CCC meetings for further discussion. Any questions on 800 megahertz or ReadyNet? Okay.
Item B, contract compliance working group, Kim Hernandez.
Again, there is a contract compliance response time PowerPoint included in your agenda packet. Just as a quick overview, all reportable priorities that were reportable for July and August at AMR met or exceeded 90% compliance. Any questions on contract compliance?
All right, moving to item C.
Fire-based ambulance report. Again, that is in your agenda packet, and I will give again, a quick summary. So this is reporting on January through June of 2025 for other provider ambulance response times. So Carmel Fire responded to 479 calls during this time frame with an average 90th percentile time of 12 minutes and 38 seconds for an average of approximately 80 calls per month. With for Monterey County Regional Fire Ambulance, same reporting period, responded to 486 calls with an average 90th percentile time of 16 minutes and 59 seconds for approximately an average of 81 calls per month. Any questions on the other provider report? Okay. Karina, can you pull up the South County? Okay.
All right.
All right.
Moving to item D, South County ambulance response times. Kim?
Yes. Karina's just pulling that up. Thank you. Okay. So you can go to the next slide. Thank you, Karina. So medical responses for the city of Gonzales, city of Soledad, city of Greenfield, and the city of King within city limits were extracted from AMR's First Watch online compliance utility for the period of January 1 to June 30th of this year. All medical responses are sorted and counted as compliant or late, and we calculated using a straight percentage calculation for each priority. So we've been bringing this report since I believe last September biannually. So response time is not a requirement at the city level. The goal of this review is to ensure that no area or community of the county is underserved. Next slide. So first up, we have the city of Gonzales. There was a total of 260 combined priority 1, 2, and 3 responses, which is 93% of those responses were compliant and 18% were late. There's also a priority breakdown, as you can see. If we were to measure it at each priority level, keep in mind the call volume is very low. 84% compliance for priority 1, priority 2, 96% compliant responses, and priority 3, 95. Next slide, Karina. Next, we have the city of Soledad, and we have excluded Salinas Valley State Prison and CTF because those were asked to not be included and kind of called out separately, which is being worked on separately by the epidemiology team. So this is just city of Soledad, anything within the city and limits excluding the prisons. Total of 670 combined priority 1, 2, and 3 responses, which is overall compliant responses of 94%. Looking at the breakdown, priority 1 is 93% compliant responses, priority 2 is 94%, and priority 3 is 94 as well. Next slide. We have the city of Greenfield, total of 491 combined priority 1, 2, and 3 responses. Overall, 93% of the responses were compliant. In the breakdown of priority 1, 2, and 3, 88% of the priority 1 responses were compliant, 96 for priority 2, and 93% for priority 3. And next slide. King City, total of 464 combined priority 1, 2, and 3 responses. Overall, 93% were compliant. Priority 1 was at 97%, priority 2 was at 93, and priority 3 was at 92. Are there any questions on the South County information data?
Can you clarify again the difference between priority 1, 2, and 3? I'm just more aware of the code 3 priority 1 versus non-code 3, but
So priority 1 is the highest acuity calls, cardiac arrest, choking, hanging. There's others, but those are the highest acuity calls. Priority 2 and priority 1s are also non-divertible, so they're going to be a code 3 response that cannot be diverted to another call. Priority 2 is also a code 3 response, but can be diverted to a priority 1 call. And priority 3 is a code 2 response that can be diverted to a priority 2 or a priority 1 call.
got it. Thank you.
Can you use your, sorry, can you use your mic just so.
Gonzalez, please.
Okay, can you go back to the Gonzales slide, Karina? That was the third one. Okay.
Thank you.
Any other questions? Okay, thank you.
Right. Sorry, moving on to item E, Kim.
There's no
for-
report this time.
Oh, there's no report. I'm sorry. My apologies. Sorry. Thank you. Moving on to old business, item A, those are on hold. I'm sorry. So, item B, Teresa.
Thank you. If I may, quickly on item A on the EMS ordinance revision, I think given the staffing shortages, we are going to postpone this item until we are more, we bring more staff into the team. If it's okay with the committee members, we'll remove this from the agenda for now. We'll keep an eye on it and we'll bring it back once we are ready to tackle the ordinance revision. On the health data exchange, unfortunately, I had a very aggressive timeline for getting things done, but I was not able to get health data exchange where I wanted it to be with the monitoring. But in November, I will have a full report on health data exchange.
Thank you, Teresa. Moving on to item C, EMS policy 3030. Provision of EMT determinant code to fire agencies at dispatch. Up for discussion.
So what we have is ALS Fire Rep has previously asked for a review of this policy related to the provision of the MPDS data call priority to fire agencies. We've heard from fire agencies, AMR dispatch, county dispatch, that sounds like an all or nothing data dump, which is much more than fire agencies were looking for. It may even bleed over a little bit into the law dispatch information. So there's been some issues with that. And at the last meeting, it was discussed whether we should put this on hold until there might be something more. So I'll turn this over to David Sargenti.
Yeah, thanks, Steve, and appreciate yourself and Teresa providing me with some background information with regards to this topic. I was able to speak with Chief Klimek as well, and he briefed me on kind of the objective of the topic. One of the things that I think in my research of it and with the resources you provided is there may be a somewhat of a crosswalk, if you will, to provide the data that those ALS companies are looking for, particularly with the advent of tablet command into most of our units. Currently, AMR does provide the unit, their location, and the priority. And one thing I would ask that may be able to bridge this gap, and I'll look to my AMR partners to see if they can facilitate this on the dispatch side, is the Alpha, Bravo, Delta nomenclature as well as part of that line item. That will provide the determinant code, if you will, albeit not the specific determinant code. It will provide the level of which that call is being dispatched and provide that information back to the ALS partners. So I'll kind of defer to my AMR partners to see if that's something that could be feasible.
I could take some of that. Definitely, I reached out to Tablet Command to see what information is flowing from our MDT or CAD into the greater Tablet Command forum. They have not responded back to me. Later today, I'm going to meet with Chief Christie to go into dispatch, watch a call, sort of go down on our side and see how it interfaces with Tablet Command. One of the discussions that we did have was adding it into a line item, manually speaking, once the determinant code has been generated, and if there's an upgrade or downgrade to that particular call. The part that I think, again, should be discussed amongst us all is that would be a manual input versus automated input, and there could be human error to that. As I understand it now, all the data is flowing over to the FireCAD, but that county communications feels that it's too much information to go over. So I feel on our end, we are getting the determinant, we are broadcasting the determinant. I think, again, collectively figuring a way to automate that, I think would be the best plan, and I'm absolutely open to facilitating that either way. Everybody should have the information. And in my opinion, there's also a safety issue. I think that all the CAD information the EMD information should be broadcast to you all as well, because there is information on there that could be pertinent to safety on scene, et cetera, or a changing condition to the patient. So I think today is a first step as far as seeing how the interface, for me to see what occurs on the Tablet Command side, and then to figure a tie-in that way. And I'm happy to report back or to set up a meeting outside of this forum to touch base with everybody on the ALS side as well.
No, I appreciate that, Will. You know, I think right now what we're seeing in tablet command is highlighted in blue, the unit, the priority, and where they're coming from. So I'm interested as well to see how that is either gathered from the data that your folks are entering in on the EMS side, or is it a manual entry? I don't know the answer to that at this point. You know, I think this is pretty important as we look at transitioning into BLS units. I think that type of information is going to be key for us as first responders to understand what's coming towards us. And I'm not sure if that nomenclature has been determined yet, but I'm sure we'll talk about that a little further on in this agenda. So thank you.
Yes, Chief. Yeah. As far as I understand it now, that it is an automated feature with what is going over to the tablet command. Looking back at previous emails, there was discussion or some sort of release from AMR through tablet command to allow all MDT data over. So again, I think it's probably best for me to see how it all interfaces against her, and then we'll move forward from there. I agree. I think that more information is better. Regarding the BLS units at this point, there is no plan to integrate them into the 911 system. Those BLS units are solely being used for interfacility transfers to ensure that that workload is taken off the 911 system. So the plan is for 3 of those units. We have 1 deployed now, second one in October, third one hopefully in December. Thank you. And moving on to item E.
Very good.
EMCC appointment, reappointment. Steve?
Thank you. A staff report is included in your packet, so you can see where everybody stands. One little update as far as Chief Solons as a BLS fire representative, there was a little hiccup with the clerk's office, so it looks like it'll be on the agenda for the board to approve in at the end of this month. So you'll be just need to go get, once the board takes action, you need to go get the oath of office done, and we'll get you on the committee and up here at this table. Other than that, we're recruiting for citizen reps. Teresa mentioned have an additional citizen rep position that we need due to Harry's retirement from this committee. So we'll be reaching out for people, and hopefully we'll have some news next meeting. Thank you.
Thank you, Steve. Moving on to item F, 2024 EMCC annual report.
Again, a little hiccup on this one. It's going to the board this month for their review, and we'll let you know when it gets on the agenda. Thank you.
Thank you, Steve. Moving on to new business, item A, PCR data standardization. Teresa Rios.
This is a project that I took over from Blake. Given the current situation, we're going to put this project on hold, probably to start at the beginning of the year. We are projecting that by then we would have recruited for the 2 EMS analyst positions and would be out of the holiday season as well. This is a project that I really want to start, and I want to be very hands-on. It is the kind of project that I love to do. So I'm looking forward to it. But given the situation, it's just not something that we can tackle at this time.
Thank you, Teresa. Moving to item B, EOA ambulance contract transitions.
The transition is well underway. We are holding regularly scheduled meetings with AMR. Kimberly Hernandez, who is the primary on the contract administration, is leading those meetings with the AMR team. Kind of running parallel tracks with that. We are looking at some of the other programs that were part of the proposal from AMR, including the hybrid paramedic CCT program, looking at how to structure that and what we would need to get that approved by the state. Deborah conducted some research. She looked at the different LEMSAs across California that have a similar program. to see what are the items that they include as part of that scope of practice. We've had an initial conversation with Dr. Burley to see how he feels about that, and a conversation with AMR as well, and trying to put a timeline together so that we can move this forward. The other one is on the use of BLS, as Will mentioned. We are not going to, well, we're going to phase in the use of BLS in the EMS system, and we are going to start by utilizing BLS for IFTs, monitor the data, see what that does to the system, and then moving to the next tier. We also want to make sure that we engage our stakeholders in that process as we move forward. So on February 1st, the only thing that we're going to see is BLS being used for IFTs. But how and when we move into the 911 system is going to depend on what we see with the change in IFT. It is the goal to do it, but we don't want to throw too many things in the mix so that we know how each component as we are implementing it is affecting the system. Let me see, anything else? Oh, the advice nurse line, the nurse advice, I always say it backwards. That is something that we need, it's definitely going to need conversations with County Com because of the access to the CAD. And also not likely that we'll be up and running on February 1st, but also something that we're starting to work on what that implementation would look like. Happy to answer any questions or get anything else, Kimberly? Okay, thank you.
Question. Like to know, have you planned out what that stakeholder engagement might look like? Just trying to see the process, how is it going to fit with different engagement from the different stakeholders, specifically the hospitals, when it comes to different type of programs you're talking about? Can you repeat that? Because I'm not hearing you very well. I'd like to know, have you thought about what the stakeholder engagement process is going to look like and when is it going to start? So a couple of things about that. One of the things that we want to do is to meet with the different stakeholders and just kind of go over the new agreement. But we were looking at the timeline. We didn't want to start too soon and then get confused with the current contract and the new contract. So we are working on trying to get our ducks in a row. We will be polling the stakeholders to try to get a sense of the timing of it, because we also have the holidays coming up. But we know that this needs to happen before February 1st. And for that, we will do the presentations and bring the stakeholders together with focus meetings for hospitals and the things that affect hospitals directly, and then fire agencies and other stakeholders. As far as the program, for example, if we're talking about the BLS, the increased use of BLS, is that one of the examples that you're thinking of? Actually, all of them. So yeah. I was just more thinking about a clear timeline on when you're going to start the stakeholders meetings. And then also, what is your plan on trying to get everyone around the table to have those discussions? So it was more of the process of how you're planning to do this and the timing of it. So that is specifically my question is, when are you going to start? So the first part is we're gonna pull the system to get some dates on as to when it would be better to do the first set of meetings. And the first set of meetings is simply to say, this is the new contract. These are the features of the new contract. This is what is new about it. This is how it works. That's the first part. Now, for example, the increase of BLS, I'm gonna take that as an example. When exactly those meetings will start, probably closer to when the contract begins, because we need to get other things lined up that are gonna go up live on February 1st. And it's not in the increased use of BLS as it relates to 911 calls is not going to start on February 1st. So we will engage at some point. A clear timeline for that we don't have at this point.
I'd like to chime in on that as well. I appreciate my colleague asking the question, because that's the exact question I have. Teresa says, we spoke after the last meeting that we were supposed to have the stakeholder meeting in September, and I've yet to see any dates come out. So we really need to move that forward, and I don't want to use staff and I don't want to use holidays as an excuse not to meet, because we are really needing to have the conversations and start the dialogue on what this looks like in transition outside of what you folks are doing internally.
Yeah, and so we're working on those. My goal was to my initial thought was to have those meetings in September. But again, we don't want to get the new contract and in the current contract, the features of those two contracts mixed up. So the meetings will take place. But again, we're going to pull the system to start getting some dates lined up. And we're working in the background to tailor presentations for each of the groups.
Okay, yeah, I wouldn't worry about the contracts being mixed up. We're pretty competent in the contract that we've had for the last 10 years. We're more concerned about the one that's coming up.
Very well.
Okay, moving on to item C. Seneca, I didn't know if they had rescheduled.
Dr. Burley gave a report already on that.
Okay, thank you. Okay, moving to announcements for the good of the order. Any member of the committee may make announcements or comments. The EMCC may not discuss or take action on any item raised during announcements, except to decide whether to place the matter on a subsequent agenda.
Yeah, Will, I have one. It's actually on the agenda, so I'm hoping that I can at least get some information. It's item D under old business, prison response report. Being new to the committee, I don't know what that's about. So if someone could give me at least a highlight of what we're trying to accomplish with that and what we're analyzing and what we anticipate the outcome to be.
I can answer that question. I think I responded to your email about it. It is an item where we are looking at the data from the prisons just to see the demand in the system, response times, and Kimberly, I think you.
So this came about when we started reporting on the South County data, extracting the prison separately from the rest of South County to kind of highlight the impact the prison has, especially one thing that's being worked on is the time on task for prison calls versus, let's say, a Soledad call. Like how much longer is it to take a unit out of the system for a call at the prison versus a call in a similar geographic area like Soledad, right? So that's what our epidemiology team is working on.
And then what are we trying to get out of that other than acquiring the data? Is there going to be some action items to that point, or is it just for data gathering purposes?
Well, I think that it depends on what the data tells us. You know, that will tell us whether we have action items and what those will be.
Have you determined what the criteria is for that? Have you determined what the criteria is for that data and the decision points for that?
No, we haven't. We want to look at the data to see what it says. You know, if, for example, comparing the time on task, and if we see a big difference in the time of task, then we asking the questions and why. If there's a reasonable explanation, if not, then how do we change it? In terms of the demand, for example, we reported, I don't know if it was July or the meeting in May, about we are currently attending the meetings at Salinas Valley, and just looking at the utilization of services. They also are looking at the data and realizing that for substance abuse calls, that they may be able to treat more patients in-house, and they were changing their policies internally. So we want to look at the data just to figure out, are there any other maybe low-hanging fruit, things that we can work on with the prisons to make things run more efficiently.
Okay, thanks.
Yeah, hello, this is Emmanuel Vega from Greenfield Fire. Along with that data from the prison, are we going to be looking in towards numbers where ambulances are diverted to the prison that are already going into Soledad, Greenfield, and Gonzales? Would that be included in that as well?
It is not part of the original data analysis that we're doing, but we should make note and talk to the epidemiologists about that.
Yeah,
Thank you
absolutely.
for bringing it up.
Yeah, I think it'd be really beneficial for our South County agencies that deal with this.
All right, moving, I guess, I'm sorry, next regularly scheduled EMCC meeting is scheduled for Wednesday, November 10th. And we'll adjourn.
Thank you all for your
Thank you.
participation.